This is the Mepilex Border Post Op AG, a dressing designed specifically for surgical incisions. It has clear borders to allow skin inspection, a viral and bacterial-proof backing film, a highly flexible pad consisting of a spreading layer to maximize breathability, a retention layer to securely lock in what has been absorbed, a silver impregnated foam, and finally Safetec adhesive. Now, this is not the adhesive you would normally find on surgical dressings or tape. Safetec is designed to gently mold to the contours of the skin and thereby minimize irritation or damage like blisters and maceration. In doing so, it also minimizes pain during removal. You will note that there is Safetec adhesive across the whole contact surface of the dressing. This is how Safetec protects the skin and incision. Exudate will pass through the small holes in the contact layer. The silver foam then absorbs and transfers exudate to the retention layer. The dressing allows you to see absorbed exudate right away, but the retention layer ensures that no fluid is sitting on top of the patient's skin. Safetec is also hydrophobic and will therefore not stick to the incision, nor will it in any way disturb sutures, staples or tape strips. And, when properly applied, it will provide Mepilex Border Post Op AG with a 7-day wear time. The silver impregnated foam supports your SSI reducing strategies with an antimicrobial effect in the dressing, killing 99.9% of the pathogens. This effect is sustained up to 7 days. Now, let me show you Flex technology. The Flex cuts in the pad allow the dressing to stretch in all directions, making it conformable and comfortable, adapting to the patient's everyday movements, even if this is an extreme stretch that I'm showing you here. And remember, do not stretch when you apply the dressing. So, for the application. When you apply the dressing, it is very important to first ensure that the skin is clean and completely dry. Choose a dressing size with a pad that is about 1 inch or 2 centimeters longer than the incision. If you apply it to a knee, have the leg bent between 10 and 20 degrees, and again, remember, never stretch the dressing during application. Start by putting about 1 inch or 2 centimeters of the middle release liner. Place the dressing on the skin, covering the incision, and then slowly pull the rest of the release liner about 1 inch or 2 centimeters at a time. Press the pad down first, and use your thumb to support the dressing. You should try to minimize wrinkles and bubbles, much like when you apply a screen protector to your phone. This will ensure a showerproof seal. Now, continue with the longer of the 2 remaining release liners, again about 1 inch or 2 centimeters at a time. Finally, you remove the smaller release liner and you are done. Always remember to smooth the dressing in place to secure a good adhesion across the whole dressing. A question we often get relates to allergies. Do not use Mepilex Border Post Op AG on a patient that is sensitive to any of its components, including silver. It is also good to know that the dressing can stay in place during X-rays, CT scans, or ultrasound MRIs. Please note that you do not need to pre-wet the dressing. The silver is activated by wound fluid. There is also no need to warm or stretch it before application, and when applying it to a knee, only a 10 to 20 degree flexion is necessary. Finally, when is it time to change the dressing? The dressing really can manage a lot of exudate. Seeing exudate does not mean you have to change dressing. You can change the dressing when the pad is about 80% saturated or when it touches 3 out of the 4 corners of the dressing. like this. So, to summarize, Mepilex Border Post Op AG will be gentle to your patient's skin and wound. It will be flexible and comfortable. Manage exudate well, be shower-proof, and provide up to 7 days of wear time with an antimicrobial effect. When you apply it, do make sure that the skin is clean and dry and don't stretch. Thank you. For more information, please reach out to your local Mölnlycke representative. And don't forget to give your patient a smile.